Thanks for coming in today. What was your name?
Heidi.
Heidi. Okay. Heidi, today I'd like to ask you a couple of questions. My name's Casey, nurse practitioner student, Maryville University. Just like to sit down and get a little history from you. Is that okay?
Yes.
Great. So what are you in here? What are we seeing you for today?
My lower left calf.
Okay.
Sore.
Lower left calf is sore. Okay. And when did that start?
Probably in the last 2 months.
Okay. Lower left calf. And how long is what's the duration of like the pain level at, or how long does it take place?
It's just short.
So it sounds like you're saying short. So is this something that's taking place?
Like after I run, it's just it's sore for a short duration of time.
So it happens after you run.
Yeah.
Okay. And is it aching? Is it burning? What does it feel like?
It's achy, but also sometimes I have a sharp pain in the Achilles area.
Okay. Okay, so aching in your calf?
In my calf, and then a little bit lower towards my heel.
Then you said that you also have pain in your Achilles, and that's more of a sharp pain?
Yes.
Okay. Okay. What aggravates it, or what seems to aggravate it?
Just long runs. It doesn't hurt while I'm running, just for a short time after.
So it doesn't occur during your run?
No.
Okay. And, we kind of went over this one already. Radiation, it means like where it takes place, and you said that it takes place in your calf. Is it your upper calf, just below your knee, behind your knee, in the front of your calf? Where exactly?
Lower on the side.
Outside or inside?
Outside.
And then it radiates down to your heel?
Yes.
Okay, perfect. And then the timing of it, does it take place during your run? Well, you said it doesn't take place during your run. How long after your run does it start to cause you pain?
Probably about 15 to 30 minutes after. But then it starts to alleviate within an hour. But it can still be achy for up to more than that.
Okay. And so the severity of the pain, how intense does it get on a scale of 1 to 10? So 10 being the littlest amount of pain, or 1 being the littlest amount of pain, up to 10 being the worst pain you've ever felt in your life.
Probably about a 3.
Okay. And is that 3 in your calf, or is it in your heel? Where's kind of the worst pain?
Kind of in between my calf and heel. So, or right above my heel towards my Achilles.
Okay. So, outside of that, I'm gonna ask you a little bit more specific questions. Just really, is there anything else you feel like you need to tell me about this concern? Okay. I'd like to talk to you about your past medical illnesses or past medical history. Have you had any hospitalizations?
Just when I was very young, when I was 2.
What took place?
They thought it was tonsillitis, but I think it was just a viral type infection.
And it took you to the hospital. Did you stay there?
Yes, for 5 days. For mainly dehydration.
Okay. Is any other hospitalizations?
No, just childbirth.
Okay. How many children do you have?
4.
Okay. So those are all any C-sections, anything like that?
No, all regular births.
So. So any major childhood illnesses outside of that viral infection?
No.
Okay. So no. Did you have tubes or anything?
Nope.
Okay. Any major adult illnesses?
No.
Okay. So this next one's in regards to serious injuries. Any serious injuries or lacerations that might have taken place, trauma, anything like that?
Broken wrist, broken toe.
Okay, tell me about the broken wrist.
Fell off the monkey bars when I was 6. And then fell off my bike when I was 12.
So broken wrist at 6 years old, fell off your bike. Did you break your wrist too?
And I broke my wrist.
Okay, and how, 12?
12.
Okay, sorry, takes me a one sec. And then after your bike, you mentioned something else. What was that?
Broken toe.
Okay, broken toe. What took place there?
Just a heavy object fell on it.
Okay. Did you have stitches or anything?
I had stitches in the toenail bed.
I can only imagine what that felt like.
Very painful.
Let's see, any other concerns, like serious injuries that I need to be aware of? No? What about immunizations? You all caught up?
I should be, yes.
Okay. Do you know when your last immunizations were? Do you have know where they're at?
I know where they are. But my last tetanus, I'm probably due for my last tetanus. Nope, I'm not. Last tetanus was in 2013. Other than that, nothing since school age.
So all your school ones are completed?
Yes.
Okay, how about like a flu or pneumonia vaccine?
No.
Have you ever had any before?
No.
Have you ever thought about it?
Thought about it. But not concerned right now with it.
Okay. Are you on any medications?
No.
Okay. Do you take medications at home, like for pain or anything like that?
Occasionally some ibuprofen.
Okay. Do you have allergies?
Yes, just seasonal.
Okay. Ever had a transfusion before?
Nope.
Okay. Any mental health concerns? Have you ever been like admitted for any mental health concerns or had a history of it?
For myself, no.
Any recent lab work completed?
Yes. A couple of years ago.
Okay, what happened there?
I was just having a physical for, my sister is diagnosed with thyroid cancer, so I wanted to get evaluated for that.
Okay. Okay. Is it okay if we get some records on that?
Yes.
And where are those records at?
They're at Ogden Regional Hospital.
Okay. So as far as your family history is concerned, does your family have a history of any mental illness related issues?
Depression.
Okay. And where's the depression located in your family?
My mother and my sister.
Okay. Any hypertension, high blood pressure, low blood pressure, heart attack?
Heart disease.
Okay. Where's that located?
My father's father.
So your grandfather?
My grandfather.
Okay. Cancer?
Yes.
Okay.
Melanoma.
Oops, hold on, I apologize. Okay. Who?
My grandmother.
Okay. Sorry. Okay.
And my sister with thyroid cancer.
Okay. Any other family history, disease processes, any other concerns?
My
that I
sister.
can be aware of?
My sister has epilepsy.
Great. Okay.
Draw it in there.
Sister has a seizure disorder. Oops. I guess I could just put epilepsy, but okay.
And my dad has the history of kidney stones. I don't know if that
Okay.
is relevant.
It's good to know. Okay.
That's it.
Okay. Thank you. This ends our session in regards to the HPI at this time.